Certainly, at this point, in many places around the world that already have experienced the Omicron surge, we are beginning to see very abrupt decrease in numbers of cases. It doesn't mean it's happening everywhere, because the wave of Omicron reached certain parts of the country before other parts, and certain countries before other countries. I think the peaks and the falling and the drop in cases is going to go in waves from east to west, largely because that's how Omicron did hit this country in particular. So I think overall, because of the large numbers of populations on the northeast and the east coast, is that we influence very much what happens in terms of the numbers in the country overall. I think we're beginning to see already peaking in the United States overall. But does that mean that we've peaked everywhere? The answer is no. I think for many people, there's been this sense of almost an anticipation or a hope that there'll be one day when COVID will be completely gone, that they'll wake up and say, okay, today there's no more COVID, and yesterday there was COVID. This is very, very unlikely. I think it's a little bit premature to now change abruptly behaviors. I think what we should do is continue to do what makes sense. And by that I mean, obviously, is wearing masks indoors in any public setting. That's very important. As well as, using the testing strategically, not to just get tested for the sake of getting tested if you don't have any symptoms.